feel overwhelmed at times? Confused with how you should raise your child or how to be a mom? You're not alone. Welcome to the Pure Moms, Pure Love video podcast. This is a safe space where we share stories about motherhood, parenting, friendship, love, and life. Here, there are no judgments, just your own experience and journey. Because there may be a lot of ways to be a mom, but all are coming out of pure love. Pure Moms, Pure Love video podcast is brought to you by Absolute Distilled Drinking Water.
We are on the third week now of our Mommy Welfare Month celebration. And so far, every episode, we are learning a lot. Together with Absolute Distilled Drinking Water, we are here to celebrate the small wins of our mommies. We want to also remind them that self-care is also key to giving the best care to their families. Hello everyone, this is Feliz Lucas, your host, and for today's episode, we are sharing with you some of the best mommy discoveries here in Pure Moms, Pure Love video podcast. We'll take the discussion into the roller coaster ride that is after birth. A lot of mommies have shared their birth experiences with us through the Absolute official Facebook page. Let's take time to read some. Mommy Jean says she has struggled with giving birth during the pandemic, something I think a lot of mommies out there can relate to. But she coped with the support of her husband and God's guidance. Yes, nothing is impossible with God, our main source of strength in trying times. Today, our healthcare professionals guests will discuss what we need to know after giving birth. Gusto natin yan. Ano bang dapat gawin? Our first guest is a pediatric dermatologist, Dr. Camille Tuazon. And let us also welcome Dr. Kristen Cruz, OB/GYN lactation consultant. Hello, doctors! Ayan, so you are also a mom and you are a practicing professional. How are you balancing this?
I'm okay naman. I have a very supportive husband and family. So of course, you lack time, but then, of course, they understand. And then I have a very good supportive family and group. So I'm good.
Wow, parang summary yan nung nung second episode natin on co-parenting. How about you naman, Doc Ten?
For me, I'm so happy na finally we have adapted to the new normal. We have this face-to-face activities. I think for the last 2 years, kasi my twins are 4 years old now. So for the 2 years na talagang sobrang nag-bonding kami. No? So I'm very thankful na at least we have the vaccination already.
So I think most of the moms that we have right now, madami sa kanila, they had to prepare, pregnancy during the pandemic. What are the things that we need to prepare when we are expecting to give birth physically, mentally, and emotionally?
Actually, as an OB/gynecologist, sabi ko, grabe, ang hirap mga anak bago mag-pandemic. Ngayon, mas mahirap, no? So, during the pandemic, you need to have a swab test prior na hindi mo alam kung kailan i-request kasi we really don't know, lalo na kung magle-labor yung patient. And also, correct, pre-pandemic or during the pandemic, same lang naman yung ating preparation actually. Of course, the preconceptional care is really, really important. Kailangan before pregnancy, meron na tayong folic acid supplementation at least a month prior to conception. It would prevent yung mga bingot, neural tube defects, ganun, in 70% of the cases. Physically, kailangan prepared yung body. And how do we prepare? Of course, food is life. Okay, proper nutrition. And yung often na-forget natin, hydration. So yun, kailangan preconception pa lang, at least additional intake during pregnancy and lactation. Pero, of course, while maintaining your body weight. Siguro yun lang kasi yung tip ko din sa mga patients, Doc, na at least prior to pregnancy, nasa ideal body weight. Hindi mo na mabomodify ang age mo, but your weight, kaya mo yan i-control.
I like what you said about being mindful that we cannot control our age, but we can control our body weight. And body weight speaks a lot of the delivery, and preparedness is the key. Is it a requirement ba na by default, dapat kayo as OB-GYNs or doctors, dapat by default, a mom would give birth naturally? Or do you take into consideration those things so that the mom will not feel guilty na, nako, hindi ako nakapag-natural give birth, parang I feel less of a mom? Meron bang ganang situation?
I think, every mom naman, siguro they want to have a normal delivery. But there are certain conditions kasi, especially, for example, position ng baby, na hindi ka pwedeng talagang mag-normal delivery. But I think what we can control is our weight talaga as moms, lalo na kasi I have a small pelvis. So yung ubi ko, she really minonitor niya yung weight gain ko. Kasi if I want to have a normal delivery, ganito lang dapat yung weight ng baby ko. Also, pwede ka rin magkaroon ng hypertension, especially if you are on the high-risk group.
I didn't realize that weight really plays a big role in terms of pregnancy and delivery.
With regards to the delivery, siguro message ko sa mga moms na don't feel less of a mom kung CS ka. Natural process po ang panganganak. Dati nga sa bahay lang po tayo nanganganak, no? But then, yun nga, may mga certain illness, like, kunwari, mababa yung inunan, the placenta previa, the 3 Ps, no? Ito yung mga i-watch out. Bukod dun sa weight, no? Ito yung mga factors na pwedeng, kumbaga, maka-affect dun sa iyong labor and delivery. Basta ang goal natin, safe mommy, healthy baby. Yung first is the passenger, si baby, okay? Sabi ni Doc, anong birth weight ba ng mga anak mo, Mommy Feliz?
Ako, pinakamalaki ko ata 8.
8 pounds.
8 pounds.
Medyo
Yun yung
malaki
last ko.
yun. Oo. So at least kasi we want na at least 2.5 ang ating
2.5.
kilos. Times 2.2. So mga at least mga 7 pounds. Ganun lang. Sana si baby, ideally. Okay? And then the passages. So may idea lang po talaga na balakang for the the birth canal. Okay? Yung gynecoid pelvic bone na tinatawag natin. Okay, the gynecoid, yun yung ideal na pelvic bone, kung saan kasyang-kasya talaga yung mga baby. Ako kasi, since twins, nag-preterm labor ako at 35 weeks. Oo. So, na-feel ko, ay, grabe pala mag-labor. Ang labor pain.
And you're carrying 2 souls there.
Okay? Imagine my weight. Mamaya na yun. Anyways, sobrang painful. Parang dysmenorrhea times 10. The uterine contraction, the labor pains would cause the cervical dilatation.
When you were asking me about my labor, so at first, I wanted to be this, I wanted to experience no medication. So, naglamaz. So, go, the labor pains.
Hilot-hilot lang yan, di ba? Lamas.
Oo. So, eto pa ako, proud na proud. But then, it was so difficult already. And then, my water bag broke. So, sabi ng doctor, 12 hours lang. Kapag hindi ka nag-labor, we have to cut you open already. So, I was so fearful. Hindi ako prepared to have a CS at that time. And I was shaking so bad.
I would like kung sasabihin ko na huwag kayong mag-worry. Kasi, of course, normal naman sa atin na any procedure, lalo na kung medical, di ka naman sanay sa hospital talaga. No? So, may nandun yung fear. Okay? Because, of course, the safety. But remember, lalo na po kung sa healthcare facility kayo manganganak, we try our best. No? There are maternal factors, you have hypertension, you have something like that. Siyempre, uncontrolled natin yan. Of course. So, lahat ng kaya natin i-control, we control. Kung anemic ka, we reserve blood. No? So, lahat ng makaka-help with your procedure, we do it. Okay? But then, may risk talaga. No? Around 1 to 3%, kahit super perfect OR, nandun yung risk.
So that's why it's so important for us to be prepared and to really verbalize and to have a regular checkup with our doctors so that they can monitor us and to identify if there's something that we need to be cautious about. So I was reading our Facebook page. So there's a mommy here who shared, si Mommy Baby Ann, that akala niya hindi na siya magkaka-baby because she has PCOS. What is it about PCOS that makes it hard for a mom to have a baby?
PCOS kasi, yan, talagang kahit buong araw natin pag-usapan, very complicated, very common. Siguro kung parang simplified way is, hindi ka nangingitlog monthly. Ganon, yun yung challenge talaga, no? So, kung yung iba nga, adolescent pa lang, parang may PCOS na, no? So, kung may PCOS, meron tayong irregular menstruation, okay? Or tapos on ultrasound may presence na maliliit lang yung follicles, no? So baby follicles. Walang egg, so walang pregnancy. Ayan, lalabas na naman si lifestyle modification. Okay? Healthy diet and of course hydration, no? And maintaining your weight. Yun na naman, no?
Is PCOS hereditary or something that we get because of our lifestyle? Lifestyle. Oh, I see.
It's actually part then like if I have a teenager tapos medyo late onset, let's say 20, tapos talagang cystic din yung acne nila. So I try to do a very good history. Nagkakaroon ka ba ng amenorrhea? I check also kung increase yung kung hirsute sila or increase yung hair nila to parts ng body na supposed to be halos wala. And then of course yung acne. So pag ganon, we will request ultrasound and then if meron na then I call my OB friends.
For the PCOS moms, yung naging mom, no? So nagbuntis, so very good yon kasi we give naman ovulation induction agents that could help them ovulate. Kasi yun yung problem nila, no? So madami naman, yung iba nga nagto-twins pa, no? So pag nag-ovulation induction. So at least these moms siguro in the long term lang during prenatal care, watch out kasi prone silang mag-diabetes. Sinong pinsan ni diabetes? High blood, hypertension. Okay? Tapos, difficult labor.
How interesting, no, that pregnancy, delivery, has a direct correlation with our skin. So it's like our skin is like creating signals that there's something that we need to change in our body so that to have a better lifestyle.
That's the largest organ, ha? Yeah. Skin. So talagang very important to take care of our skin. Especially yan, yung proper na sun exposure ba? Syempre kailangan din, di ba? And then of course, hydration.
Correct. So we really need to have absolute and pure love for ourselves by filling our body with pure distilled water by Absolute, of course, diba? It's really a lifestyle change. And, you know, as you were sharing this, I realized one thing that we really need to always carry to prevent us from munching on little unnecessary fast food, unnecessary sweets, unnecessary binging, is to really have water.
If I may share, alam niyo ba kung gaano kadaming water yung kailangan natin during pregnancy? Pag adult tayo, at least 2 to 2.5 liters per day. Okay? Pag pregnant, additional 500 ml.
So mga ilan yan? Ilan?
At least 500 ml. So, at least isang extra no, na bottle yung kailangan mo. But kung kailangan pa, go lang. Kaya lang sa pregnant, ang na-feel ko, lalo na pag medyo malaki na yung tiyan mo, no? Ang daling makabusog. Ang hirap ng position, parang ganon. So, I advise more frequent drinking and eating. Parang ganon, no? Maliit-liit lang, okay? And then, pag lactating, mas marami. Around 750 ml.
Wow.
So, at least talaga, ang goal mo.
3 bottles
3
of that.
bottles or more.
I'm sure you're back to practicing already in the clinic, in the hospitals, and you're already continuously giving birth, delivery. Ano yung mga bagay na moms out there need to be cautious about now in the new normal of giving birth?
Kasi of course, ngayon kasi, di ba, nasabi ko na may mga swab, dami requirement, di ba? Kulang na lang, pwede bang plastika na lang yung buong sarili? But no, di ba? Kailangan lang vaccinated tayo, of course. Pre-pandemic or pandemic, same lang naman yung concern natin, no? Of course, yung pain after the surgery or the vaginal delivery, around 50 to 60%, yun ang complaint.
Ako naman sa postpartum, I usually get questions about newborn care. It's true. Kasi especially, what will doktora kailangan ba i-cleanser, i-moisturizer, na sila ganyan. So, there's no perfect manual for parenting. And everything, parang no matter kung gaano nakadami yung kids, it's always a trial and error thing, no? So, I think what we have to think of will be always their safety, no? Sa ganong aspect, I think you also have to take care of yourself. Yung changes ng mom, we have to address. Kasi syempre, yung ibang nagkaroon na ng darkening, stretch marks, increased weight, nandun na. So, yung mga ganon na after pregnancy, pre and post pandemic until now, as a doctor, I think we have to address that also. And we need to support each other on that aspect.
It's so nice to listen to our professionals because you practice what you preach. You've been practicing pedia and OB, and eto kayo rin, you are moms yourselves, twins and with an 8-year-old. And you shared with us the common struggles that every mom goes through. What are your tips for us, for the new moms out there, to prepare themselves? Ano yung mga struggles na hindi nasasabi masyado, na nagugulat, tapos doon yung nagiging cause ng postpartum?
I-identify muna natin ano yung postpartum period, no? So, that's the time from delivery, yun na nga yung 4th trimester ngayon which could last at least 4 to 6 weeks after. So, walang definite time, pero yun basta, yun yung after birth. Okay, after delivery, what's next? Okay? Diba very overwhelming? Ang saya, nakita ko na rin sino kamukha, no? But then, daddy pala. Okay, and then, so that crucial period, we focus on the baby, no? So, laging baby, but we forget the mom, no? So, we should also watch out yung mga, of course, the pain, okay, yung after pains niya. You should go to the ER whenever you feel na may pain sa chest or parang hirap ka huminga, okay? And then, wag naman magka-seizure. If you have thoughts of hurting yourself, ER po yun. Hindi counseling lang or ano, punta ng ER or talk to your healthcare provider. Of course, kung may fever, ayaw natin yan, di ba? Pero during the postpartum period, watch out din natin yon kasi it could be breast engorgement or mastitis, and a lot. Meron din, ano ba to, thromboembolism, pwede rin yon, leg pain, kasi prone tayo ng blood clots after delivery. So talagang salute to all moms. Talagang grabe yung ano natin, sacrifice, and then of course the love for our kids.
Correct. So there's really a lot of things that we need to watch out for. So it's best, if in doubt, ask your OB. Ano yung mga bagay? What are the things that I need to watch out for so that I can take care of my cesarean?
For the wound care, there are actually other topical medications we can apply initially. Usually, we keep it moisturized no, sa area. Tapos they ask you, are there specific medication or topical medication that we can apply para hindi rin kami magka-stretch mark, hindi rin ganun lumaki yung wound namin or yung scar? Unfortunately, there's none kasi it's also genetic. If your mom or nagkaroon siya ng stretch mark or talagang keloid former, we cannot avoid that. But now we have an advent of CO2 laser, yan, aside from the topical medication. But managing, again, expectations. And I always tell moms na, no, you give a new person in this world. You really have to enjoy all the changes. It doesn't make you less of a person. It actually made you more beautiful.
I was reading here nga, one of our mommies in our FB page in Absolute. So, moms, if you have something to share, you can also type it in and we will definitely make time to read it out. So here, Miss Chari, Mommy Chari was even sharing na yun talagang nalungkot talaga siya, na minsan happy siya, tapos biglang masaya siya. And nagkaroon na talaga ng struggle with the postpartum. I think, like you said, no, it's not just the outside wound that we need to heal, but also what's inside, the 4th trimester. And ayan, she shared na buti na lang may supportive family and friends ako. Ngayon, 15-year-old na ang anak ko. So it's so amazing how important community is, no, with the postpartum depression.
Very tiring kasi talaga merong newborn eh. So dito talaga pumapasok yung co-parenting. Magbe-breastfeeding ka na, syempre you also need rest. I think your partner or your husband, kailangan talaga they're beside you. And the whole family, kung meron man differences dun sa emotions or moods mo, kailangan medyo din sila observant. And then they have to be there, talk to you, or are you okay? I think, or if you feel you're not okay, accept it, ask for help. Yun yung nakikita kong kailangan. But I think with postpartum depression, it's different, Dr.
Let's differentiate muna. Diba? Postpartum blues from postpartum depression. Normal lang. Di ba? Normal yung ganun pakaramdam kasi na-feel ko din yun. Yung parang ang excited mo, nakita mo, pero naiiyak ka din at the same time. Kasi you don't know what to do. And paano ba talaga swaddle? Hindi ako marunong and all. And sabi ko, pero mixed emotions talaga. That's normal. Around 2 to 3 days. But, ayan, pag nag-persist, okay? More than 10 days na, malungkot ka pa rin, iyak ka pa rin ng iyak, di ka pa rin naliligo, or, it would affect your daily life na it could be depression. Ayan, your OB is your best friend after birth. So please, ayan, kaya pinagkatiwala nyo dyan lahat. No? So yan, pwede siya na mag-refer to a psychiatrist.
So mommies out there who are listening and watching this, we want to let you know that we hear you and that we see you, your struggles, yung preparation mo, your delivery, your PCOS, your challenges. We want to let you know that you are important, which is why we have created this video podcast because of you. This is your community and you are not alone. So this is pure love, and for the pure moms out there, we are doing this together. This is our tribe, diba? What is your encouragement to our moms out there so that we can be physically whole, emotionally whole, mentally, spiritually?
That's a very good question because I think every mom needs to hear this. You might have a lot of changes sa body mo, and then you will feel na parang you're not the same person anymore. And then always parang you feel parang lagi akong kulang. No, maybe you need a me time, a time for yourself, kasi you really need to fill in that so that you can also give back your love to your family. Love yourself pa din, no? You're kahit ano yung nakikita niya sa social media or mga pressures na dapat ganito yung ganyan, dapat ganito, sabi ng in-law ko ganito, sabi ng ganyan. There's no perfect manual. Do it your own way.
Yung moms natin, talagang binigay yan as parang extension of God's love. Kasi he can't be physically present. That's why, andyan moms natin. I agree, self-love, of course. And don't forget yung pagmamahal na yon sa sarili natin. It would involve yung ating pagkain ng tama. Okay? Very essential to eat right and drink right. Huwag kalimutan ng hydration, of course. Especially sa big roles natin as moms.
So mommies, as you listen and as you watch here, we want to assure that you are exactly where you're supposed to be. You are the perfect mom to your child. And ang dami nating natutunan today, ang daming lessons, ang daming encouragement, and I feel that the moms out there will feel that they are not alone and that this is one step closer to being more informed and to being more accountable with what their journey is all about. So many takeaways from nutrition to hydration to well-being. It's really important that wholeness is there. And we're thankful that Absolute Distilled Water is here, that we can really share this pure love and pure mom community that we have. I'm sure our viewers gained more appreciation and respect for mothers after knowing ba naman of all the sacrifices they make for carrying their child, giving birth, and taking care of the family. Kaya naman, remember to comment, like, and share this video para mas marami ang mga mommies natin na ma-inspire with our topic. Diba? Excited ba kayo? Share the knowledge. Yan. Thank you so much, Doc Kristen and Doc Camille, for sharing with us the best practices and giving your absolute love and care for your patients and for your children also. Stay tuned for our next episode because we are going to talk about personal parenting styles with our very special celebrity mom. I am your host, Feliz Lucas, for Pure Moms, Pure Love Video Podcast. See you next week!